Наступна доповідь буде з Узбекистану. Група авторів на чолі з Шахайдаром Шалієвичем Шатурсуновим. Доповідати буде доктор Eshkulov. До речі, для інформації, усі вчені і лікарі з Ташкентського інституту ортопедії і травматології проходили навчання в Харкові, в інституті Ситенка по хірургії хребта. Тому вони з надзвичайною повагою відносяться до Харківської школи хірургії хребта. Будь ласка.
Dear chairpersons and distinguished colleagues, Dr. Shomansur has asked me his convoy with science apologize. At the moment, his parallel report is a global spine in Istanbul. Therefore, as his colleagues, I have honor present the report on his behalf. My name is Dr. Eshkulov, and our experience in the surgical treatment thoracolumbar spinal stenosis using endoscopic monoportal PSLD posterior lumbar stenoscopic decompression techniques. And degenerative stenosis, we will remind of the most common case of pain and neurological deficit disability among elderly patients. And the development endoscopic spinal surgery has opened new opportunity for effective decompression and minimalize tissue trauma. And degenerative stenosis for diagnosis treatment, analytical criteria for have central stenosis for sagittal diameter of spinal canal and lateral rectus stenosis and foraminal stenosis. We have included 176 patients, and for both monosegmental and multi-segmental were observed. And the most commonly effects for L3, L4, L4, L5, and L5S1 segments. And for a neurologic sign, 97 patients were have monosegmental pains and 84 at multi-segmental stenosis. And for classical schisms, 176 patients, we have a classification for including A, B, C segments for patients. We have a conservative therapy, and for D classification, C and D, we have endoscopic decompression patients. And one of the earliest reports describing in published in 206, and since clinic studies, systemic reviews, and meta-analysis have confirmed effectiveness and endoscopic spinal decompression. Today, endoscopic surgery is considered one of most rapidly developing fields in the spine surgery. One of the advantages of modern endoscopic surgery is a bilateral decompression from unilateral approach. These techniques have advanced decompression, spinal stability, and minimal invasive damage for surrounding of soft tissue. Our experience is a procedure is a monoportal endoscopic equipment for high-speed diamond bore, and the investigation all allows for safe decompression and neural deconstruction and direct visualization. In our practice, we use monoportal endoscopic decompression for 5 millimeter working channel endoscope, and on 90% all operation is for PSLD method, and for interlaminar access endoscopic in 45 is discarnation, and 55% is stenosis. And a clinical case as a patient 56-year-old with neurological chronic low back pain and symptomal neural compression. We have do monoportal PSLD method, And the next case is MRI for Sh.Sh's classification D. Will do one level monopartal. And the next patient for 3 levels stenosis, L3, L4, L4, L5, and L5 is one segment stenosis, and we'll do in the one moment complex disease pathology, adequate decompression, and achieve extensive tissue damage. And in this case, male 71 years, and we will do 4 level in the 1 times of monopartal endoscopic decompression. And next patient also with a 4 level stenosis, and after a case L1, L2, L2, L3, and L3, L4, and L4, L5 cases. And results. Endoscopic techniques showed advanced early postoperative period, and from 3 months to 6 months, all of motor activity and reduced hospital time. And complication, or approximately 3 patients, we have damage dural sac, a lesion of root shields in 5 patients, and muscle weakness, paresthesia in 5% after from 3 months or cases. In conclusion, surgical treatment of degenerative stenosis, lumbar part of spine for monopartal endoscopic decompression showed effectively method of impression quality of all of patient lives and reduced a percentage of their disability. Thank you for attention.
Thank you very much for your presentation. Запитань немає? В чаті немає? Thank you very much.